Does your lower back hurt? Do you want to know why? It starts with knowing how your lower back works. Do you want to make sure that your lower back never hurts? That also starts with knowing how the lower back works. I'm Dr. Ben Quist, and let's get to it. This is really a great topic because, as we've talked about in previous episodes, the lumbar spine is one of the most injured areas of the human body. And actually, I'm misspeaking. It is the most injured area of the human body. 80% of people who live in the United States will have one or more major lower back injuries in their lifetime. So knowing how this structure works, how to protect it, is extremely important. Whoop! Okay, so we have 5 lumbar vertebrae. Then we move into the thoracic spine. We have 12 thoracic vertebrae in this kind of blue color. And then up at the top, we have our cervical vertebra. We have 7 of those guys, and they're kind of a nice lavender shade there. So the ones that we're going to be focusing on are at the bottom. Now, one thing you're going to notice is that the lumbar vertebra are way bigger, right? These guys in the green are way bigger than these guys, and which are way bigger than these guys. So one of the reasons that the lumbar spine is so vulnerable is because it is taking the load of all the things you're doing all the way down to the bottom. So it is the base of the spine. So it takes the most pressure out of any area of the spine. And that's why these vertebral segments are a lot beefier, almost looking to be like twice the size of the cervical vertebra. The entire spine is working as a network of protection and a pathway for your spinal cord, which is in the center of the spine. And at every level of your spine, your cervical spine, thoracic spine, or lumbar spine, you have spinal nerves coming out which innervate your entire body. So it is just an absolutely incredible structure. At every level of the spine, you have 2 facet joints. So in the lumbar spine, we have basically 5 facet joints or pairs of facet joints, and it goes on all the way up. So you have all of these different little teeny facet joints in the spine working in concert to create spinal motion. Protected for a lifetime, because you only get one of these spines, right? Okay, so in the lumbar spine, what does it actually do? So there are 3 planes of motion. We have the frontal plane where you can do bending forward and extending back. We have the transverse plane where rotation occurs in the body. And then we have the frontal plane where side bending occurs. Each of the different levels of the spine have different amounts of motion of all 3 of those motions we just described. But at every level, there are varying amounts of each. So at the lumbar spine, one thing to note is because of the orientation of the facet joints, and you can see them here, they basically are set up in this type of orientation. They really can't rotate at all. So the lumbar spine has very little to none as far as rotation goes. But because they're set up like this, they really can flex and extend. So the lumbar spine is really the workhorse of flexion and extension of the spine. Last time we talked about the thoracic spine being kind of the workhorse of rotation, right? So we move down a whole level of the spine, and that's where that flexion extension occurs big time. In addition to the fact that the lumbar spine has a little bit of side bending as well, but its main job is to flex and extend. So keep that in mind as we move forward. At the end of this video, I'm going to give you 3 different techniques you can use to help protect this area. 2 of which are strengthening exercises, and 1 of which is just a way to start to own the movement at your lumbar spine that I think you're going to really like. So let's move on. Come on over here. Over here, I have all of the different areas of the spine graphed out by spinal segment in how much motion occurs at all 3 different planes of motion. The reason that I think this is kind of really a neat chart is because it really illustrates how much the spine works together as a group from top to bottom to contribute to all these different motions, but it also shows you what each different level of the spine really does. Because everyone, like we said before, has a lot of differences in how much it does of all these 3 different motion patterns. So the first one, flexion and extension, so that will be bending forward and extending back through the lumbar spine. You can see that at level 1 through 5, if we look at the line that's charted over here, there is about 10 or 12 degrees per level of flexion and extension that you can get at that lumbar spine. So a pretty good amount of flexion extension. Then that line decreases where there's less flexion extension happening at the thoracic spine. And then it goes back up again where you're getting quite a bit of flexion and extension at some of the levels of the cervical spine as well. When we move over and we go to side bending, you can see that side bending, there isn't quite as much at the lumbar spine. You're maybe getting 5 degrees or so per level. And then, even into the thoracic spine, we're getting a little bit more. And then up into the cervical spine, we're getting at some levels quite a bit of side bending in that area. Moving over to rotation, and this is the one I want you to really look at. How much rotation does the lumbar spine do? Basically like nothing, right? You're getting like a degree or 2 per vertebral level. And we kind of showed that because of the orientation of those facet joints, it just physiologically can't rotate because of the anatomy of that structure. But then once we bump up into the thoracic area, because of the way those facets are orientated, we get that big bump into rotation happening in the thoracic spine. And then of course, because of the anatomy of the cervical vertebra, there is also quite a bit of rotation that can occur up at your neck. How do we protect this lumbar spine? What do we do to make sure that we're not injuring it? And one of the things that I like to tell people is make sure that you are knowing and owning your motions. And the places that you have to kind of like know and own your motions are really, you got to know what the thoracic spine does and what you want it to do. You need to know what the lumbar spine does. And then you also need to know what's happening at your ball and socket or your hip joint. The structures of the spine, they are not meant to be put under tons of load and then actually have movement happening at the spine. That's where a lot of the injuries happen, especially if you're combining spinal ranges of motion. Like, let's say you're trying to lift a heavy box from the floor, but you also flex at your spine, but you also rotate it, and then you tried to lift that up. Your chances of injury go way up because you've combined spinal motions. So really, and I always like to tell my interns this when I'm working with interns, when you're lifting something heavy from the floor, if you're doing proper body mechanics, how much motion should be happening at the lumbar spine, the thoracic spine, and the cervical spine? And their usual answer is to look at me like a deer in the headlights, but and then they're like, well, is it none? I'm like, yes, exactly. When you're picking up something heavy from the floor and you're using proper lifting mechanics, there should be no motion happening anywhere in your spine. All that motion is happening to that ball and socket joint below, that hip joint. So that's where one of the neurological kind of training techniques I'm going to show you in a moment becomes so important, that you have to be aware of when you're moving at your lumbar spine and when you're moving at your hip. It's extremely, extremely important. So let's get into those 3 techniques. Okay, what is happening over here?
Just feeding my baby fat.
Your baby fat. Okay, I don't know what's going on here, but we're going to move into our 3 techniques. Let's go back over here. Many people have a really hard time, like we've talked about before, differentiating movement that's happening at their lumbar spine, so flexion, extension, versus what's happening at this ball and socket hip joint that's a little bit lower down. What I want you guys to do, and this isn't something that you have to do all the time or anything, but it's something that you should do until you 100% master it, then you can kind of move on. But take one of your hands, pop it on your lower back. So what you're going to be doing with that hand is trying to sense or feel whether any motion or bending is happening at your spine, and you'll feel it. So as soon as that lumbar spine starts to flex or bend, you're going to feel it with your hand, and then you know that you're moving at your lumbar spine, okay? So what the drill is that we're going to attempt to not move at our lumbar spine while we are flexing forward at the hip joint, okay? And of course, Jeremiah is a fitness expert, so like he's doing that absolutely perfectly. But as he's coming down, you can see no movement is occurring here at all. So Jeremiah, show them what that would look like if you're doing that wrong. Okay, so now he's moving. He can probably feel that a little bit on the back of his hand, that the shirt is pulling apart, and then he's moving at that spine or getting flexion here. So when they always talk about lifting with your legs and not with your back, this is kind of what they're talking about, is that you need to lift without moving at this area of your body. So come on back up. So the full drill is, when you start, you flex forward to the point where you get tension in your hamstrings, okay, without moving at your lower back. Are you feeling tension there, Jeremiah?
Yes.
Okay, so he's feeling tension. Once you're feeling tension, I want you to stay there, lock that position in, and then try to even push down more without moving at your spine even more to add more hamstring stretch. So like those hamstring stretches Jeremiah and I have showed you in the past, this is one of the best ways to stretch them, because you're working on not only stretching the hamstrings, but you're also working on taking ownership of your lumbar spine, where you are stabilizing through there while you are stretching through there. So once you've held that for a moment, now stay down there, get back down there. Once you've held that for a moment, now flex at your back. Boom. And you should feel the stretch immediately come off of the hamstrings, right? Now, extend back through your back, go back into the kind of neutral spine position until you get the hamstring stretch again. Now come back up to standing. So it's kind of a several part move, but really kind of working on getting ownership of what is hip flexion, what is lumbar flexion, how do the hamstrings interplay. That's one of the reasons why hamstrings so often factor into lower back injuries, because if someone is really tight there, they can't move into their ball and socket joint at their hip as well as they should, and then when they try to pick something up, they just don't have the range of motion to do it. They have to use lumbar flexion, and then bang, bad injury occurs. And or if someone has a fusion at their lumbar spine, it gets even worse then, because you can't flex or extend. So if you try to do that, you're just in a world of hurt. So that's number one. The two other ones that we're going to show you are just little strengtheners and muscle activation exercises. These are both great ones to do as a warm-up when you're going to move into some other activity that you're going to do throughout your day or a workout that you're going to do, or you can have them as standalones. So again, just to reiterate that first one, that is something you just have to do till you 100% have ownership of it. And I know that seems a little bit odd and weird, that drill, but do yourself a favor. Learn how to move at those segments and those joints and own that. Just like we showed you a moment ago, you will greatly reduce your risk of injuring that lower back if you are able to do that well. All right, let's move on to number two. Second move that we're going to go over is the bird dog. And I'm going to show you several variations of this. This is one that you can do for a lifetime. It's a great priming technique. For those of you who maybe have not done as much strength training, it is a great strengthener to begin with, but eventually it just becomes something that you're doing to kind of turn on all those muscles of your spine. It hits the lower back quite a bit, but it also hits all the other areas of the spine and also the muscles of the hips and the muscles of the shoulder blades as well. So a basic bird dog is setting up your hands directly underneath your shoulders. You're going to protract the shoulder blades a little bit to lock that area out. You're going to get your spine into spine neutral. With a bird dog, there is no motion that should occur at any level of your spine. So you are then locking in the central structures of your body, and then you are extending one of your legs, and then you're extending the opposite arm, keeping the shoulder blades depressed, keeping everything locked in through the spine, no motion. Typically you're holding, but you can do different patterns where you're moving through those joints, but you are still keeping completely fixed through your spine. You can do lateral patterns with the arms and legs. You can kind of play around with it, but the traditional move is to press out, keeping everything stable, and then to lock into that position and hold for 5 or 10 seconds and switch. I'll do them for a minute or two just to kind of warm that whole area up, get it primed, get it activated before I move into anything more intensive in my workout. The last move in the series is going to be a side bridge. Now, this movement pattern, most of the studies I've seen on muscle activation, it is the one that activates your quadratus lumborum muscle more than any other movement pattern. And the QL is like this really big structural support muscle on either side of the lumbar spine. Very, very important for that is strong and that it's able to stabilize. So this move capitalizes on strengthening that. You can do this in several different variations as well. The first one I'm going to show you is with knees bent. So you want your elbow directly underneath your shoulder on the top arm, and then your knees, hips, and shoulders should all be in alignment. And you're going to press your hip up off the ground until you basically have a straight line from your shoulder to your knee, and then hold position. I also like to get my neck in neutral, so you shouldn't be cranking your head into any weird position. Normally, I like to see my participants be able to hold this easily for 60 seconds, sometimes working up to 2 minutes as a max. Once you can hold a side plank with your knees bent for a good 2 minutes, then you would move to the next variation, which is extending out your knees, so everything is a nice straight line. And then you would do the same exact movement pattern, pressing up and through. Sometimes people will have some pain in their shoulder joint when they press up and through here because there's so much compression. Totally fine to have a hand down there to take some of that load from that shoulder and allow you to do it in a more comfortable fashion. But the goal would be to get into some type of position in a side plank, full side plank, for roughly 1.5 minutes to 2 minutes. You would do it on one side and then obviously repeat on the opposite side. Thank you guys for watching. We appreciate you all. Let us know any other types of videos you'd like to see us do. Please like our channel. Please subscribe. Do you have anything to add, Jeremiah? What's going on? What's going on in your life?
Not too much, actually. It's pretty good these days.
Well, good.
Yeah.
All right. Well, we'll see you guys next week.
See you next week.